So welcome back, guys. The next in the topic is sarcoidosis. Sarcoidosis is a disease where there is accumulation of T cells or T lymphocytes, and along with that monoclonal phagocytes. In different organs. Giving rise to the typical manifestation or the manifestation of the sarcoidosis. What are the typical features? Typical features of sarcoidosis, they consist of number 1, non-caseating granuloma. Non-caseating granuloma. This is most commonly seen in the lungs. Most commonly in the lungs. So granulomatous disease, and this consists of giant cells and inclusion bodies. So these inclusion bodies, in as far as sarcoidosis is concerned, there are different types of inclusion bodies that are seen. Number 1 is what we call as shaman bodies. Shaman's bodies. What are these shaman's bodies? Guys, you can just see over here that this is an image of the shaman body, where you can just see that this inclusion body that we see is basically having laminated calcifications. Laminated calcifications, these are called as the shaman bodies. The next type of bodies that you see in patients of sarcoidosis are the bodies where you find that the inclusion body is having a deposition in the form of, you can just see, stellate form, or you can just note over here that the deposition is in the form of a star-like deposition called as asteroid bodies. So you have the asteroid bodies and you have the shaman bodies. Apart from these two bodies, we have one more body that is called as residual body. So the different inclusions that you see in sarcoidosis are the shaman, asteroid and the residual bodies. Next, coming to the important different manifestation. So important organ getting involved is the lung. And in the lung, the patient will be suffering from ILD, that is interstitial lung disease, or pleural effusion, may be caused by sarcoidosis, but importantly, it is the one that causes cavitation. Cavitation in the lung and eggshell classification. Eggshell calcification. So you have cavitation and the eggshell calcification. So here is a image of the chest x-ray where we can see that the patient is having the different eggshell calcification of the lymph nodes. So here you can see that these calcifications are very clearly visible in these patients. So the important DDs of the eggshell calcification. Apart from this, when you do a bronchoalveolar lavage or a BAL, in normal cases the patient will be having a CD4 to CD8 cell ratio of 2:1. This is a normal ratio, guys. This is a normal ratio, that is 2:1. But in cases of sarcoidosis, what we find on bronchoalveolar lavage, that this ratio goes out to be 10:1 in the ratio, or you can say that it is greater than 3.5, and when it is greater than 3.5, this is diagnostic of sarcoid. Diagnostic of the sarcoid. After the lungs, we have skin manifestations. Skin manifestations are in the form of erythema, nodosum, or the patient will be having the typical skin manifestation where you can see that the patient has, where you can see that the patient on the skin develops purplish, bluish. You can just see over the skin over here that the patient is having purple or blue shining lesions. Purple, blue shining lesion. Again an image based MCQ, guys. This is what is called as lupus pernio. Lupus pernio. In the eye, they cause uveitis. Eyes causing uveitis, then they cause renal hypercalcemia, and increase vitamin D production. Increase in the vitamin D values are an important manifestation of this syndrome. Then this sarcoidosis presents with the important syndrome where we find that the patient is having multiple system involvement, where the patient presents with you can just see over here 7th cranial nerve palsy, that is 7th cranial nerve palsy. Along with that, the patient has bilateral parotid swellings. So you have bilateral parotid swelling, and the patient has anterior uveitis. Patient has anterior uveitis. So when the patient has 7th cranial nerve palsy, anterior uveitis, bilateral parotid involvement along with fever, this is what is called as the Hereford syndrome, one of the important syndrome that is associated with sarcoidosis. Apart from the Hereford syndrome, the patient also has one more syndrome that is called as Lofgren syndrome. Lofgren syndrome. What is Lofgren syndrome, guys? Number 1, joint symptoms. Number 2, bilateral hilar adenopathy. Bilateral hilar adenopathy on chest X-ray. And lastly, the erythema nodosum. Erythema nodosum. This is called as Lofgren syndrome. So the two important syndromes that are seen in patients of sarcoidosis are the Hereford syndrome and the Lofgren syndrome. Finally, to end our discussion, we end the discussion with an important skin test, that is KVIM skin test, that is not performed nowadays. It's called as the KVIM Silsbash test. KVIM Silsbash test. It's an important test that is done in patients of sarcoidosis. So what is this test, guys? This test is basically what we do in this test is that we use intradermal injection. We give an intradermal injection of a homogenized tissue of organs involved with sarcoidosis, and we see for a delayed cutaneous reaction. So this is a type 4 or a delayed hypersensitivity reaction, Kevin-Silbash test, and you look it after 4 to 6 weeks. And what do you look for? You look for the granulomas that are formed showing multinucleated cell and along with the two bodies, that is asteroid bodies and the shaman bodies. That is what is the test that is done for the sarcoidosis or the Kevin-Silbash test. An absolute test not done nowadays clinically, but just remember for the MCQ, it's a type 4 hypersensitivity reaction that is seen. The treatment as far as sarcoidosis is concerned is totally supportive and depending upon the organs that are involved. That is all about the sarcoidosis. Thank you very much.